Hello everybody, this is Dr. Eric DiMartino from DiMartino Chiropractic Wellness Center in Chesterfield. Today we're talking about vertigo. So you may have heard of vertigo before but didn't know exactly what it is. Well, vertigo is when people have that feeling of spinning or dizziness or lack of balance, and it can be a pretty miserable thing to experience if you've never had it. I'm going to explain today a little bit about what it is and the different types of causes that we find behind it. So you may or may not know that our balance centers are in our inner middle ear. And so in our inner ear we have these little canals that are filled with fluid. And what happens is there's lots of nerve endings in that area. And so based on where the fluid balance is, our body knows exactly whether we're staying upright or if we're tilted to the side. As a result, we can kind of compensate accordingly. You know, if we're staying like this, but we feel like we're staying like this, it's going to really throw off our balance centers. And so with vertigo, you might get a feeling of spinning, or you might get a feeling of imbalance where you feel like you're going to walk into the wall. And it's all from malfunctions in the actual inner ear itself. So there's three main types of vertigo. The first one is called BPPV. It's benign paroxysmal positional vertigo. And this can be brought on by age, but sometimes in younger people it happens and they really don't know the exact cause for it. But what they notice is there'll be buildup of these little crystals in those fluids that we talked about, and as a result of those crystals, your balance centers aren't allowed to function properly, and it causes that imbalance as a result. The second cause is Meniere's disease, and this typically is due to a changing or buildup of pressure in the middle ear, and because of that increase in pressure, as a result, it throws off our balance as well. And the last one is called vestibular neuritis. This is where it affects the nerves that actually control and affect the inner ear and how that functions. And this is where the role that we as chiropractors play is. As chiropractors, we're always looking at reducing nerve interference as it relates to nerves exiting from the spine, and typically the upper neck nerves affect everything up into the head, sinuses, and inner ear. And so we find that when patients have that issue, when we're able to adjust their spine in the upper neck, it's helpful to resolve those vertigo symptoms that many people suffer from. So I hope this gave you a little more insight into vertigo and its causes, and I hope you guys have a great day. Thank you.